Knock knock.
Come in.
Hi, my name is Michael Parker and I'm a student from Nevada State College. And I'm here to do insert NG2 as the doctor ordered. Can you please say your name and date of birth for me, please?
Yes, it's Sharon Larson, July 6, 1970.
Alright, thank you. And I'm just double checking your wristband. Alright, thank you. Okay, first make sure you assess your patient. Check the nose and the mouth using the tongue blade and the pen light. So see if check for any bleeding tendencies, any occlusion, and check the nose. Okay, can you please do this for me? Very good. And this one too? Good job. And that's good. So now are you allergic to anything, latex, or any medications at all?
No.
Alright. So first, I'm going to measure the patient from the nose to the ears, all the way down. And if you don't mind, I'm just gonna lift your shirt up, okay?
Okay.
And make sure your patient is in a semi-phallus position. This 30-degree angle. Okay. So I can see your xiphoid process here. Let's see. It's 60 inches. Alright. So now I'm just gonna mark this here with a tape. So now that you did that, you can go ahead and prepare your syringe. How are you feeling today?
I'm good, thanks.
So you might feel a little discomfort when I do this, but if you feel any pain at all, just raise your index finger up for me, and I will stop, okay?
All right, thank you.
So if the patient's in semi-phallus position, make sure that you put a towel or chalks on his chest, on her chest, to make sure that there's no any secretions spilled on her body. So just make sure it's right there. See a lubricant for the tube. And make sure you give your patient a basin, just in case she or he vomits. She has something to use. This is good. You can hold this for me. This is your basin. And then just make sure you lubricate. Just put it there. So what you can is you can go ahead and attach the syringe to the tube, since you have to put 30 ml of air and check for any vascular sounds or anything. So it's 30. So you put you lubricate this for at least 3 to 5 weeks. All right, Miss Sharon, just relax for me, okay?
Okay.
I'm going in now. First, you have to hyperextend the patient's head. Here you go. So I'm going in. Just relax. Just relax. Hyperextend. And after that, you can go ahead and touch her chin her to the chest like this, so that epiglottis will close and it will go through. Now the patient has 60 inches, so you keep going until you reach it, but this mannequin only goes to 50. So once it's in, you can go ahead and mark that. I'll go change the marking. Once it's in right there. You can go ahead and secure your patient's tubing by putting a band-aid or tape on her nose, like so you can go like this. Now I'm gonna put 30 ml on it first, and I will listen to the lungs for any abnormal bowel sounds. Once I put 30 ml up there. Alright, normal active bowel sounds present. So once it's in, now I can go ahead and get 5 ml of gastric secretion and check the pH and check it for any bilirubin or anything. So once after I checked it, it looks good and it's normal. You can go ahead and return the gastric fluid in the stomach, or it depends on your hospital policy if you can return it or not. So I'm returning it. So that's good. And then now I can go ahead and clamp this one. Now it's clamp. You can document everything, your patient's assessment and any abnormal findings, any bleeding, and make sure that you order a chest X-ray before you start suctions or feeding by the NG tube. So once you're done, you can go ahead and clean and make sure you assess your patient again. Check the tube if it's in. Check the nose, no bleeding. Everything's good. Alright, so I'm gonna take this off. And also make sure that you connect your client's tube to the gown with a pin to secure and prevent any complication. So once it's secured,
I was just like thinking.
you can go on the other side. So you have a pin in your gown, okay?
Okay.
Once secure, you can go ahead. Alright, thank you, Ms. Sharon, and I'll be right back, okay?
All right. Thank you.
Okay, make sure you document the time, the date, and the type of tube inserted, type of suction used, and if you ordered the X-ray, color and amount of gastric contents, and the pH, and the patient's assessment. Make sure you also put your name and your title.
Come in.
Alright, hi, my name is Michael Argeron. I'm here to discontinue your NG tube, so I'm gonna remove it, okay?
Okay.
Doctors order that. Can you please state your name and date of birth for me, please?
Yes, it's Sharon Larson, July 6, 1970.
Alright, and double check on your wristband. Thank you. So right now, before you do it, make sure you assess your patient's breath sounds and bowel sounds. So I'm just gonna go ahead and check it. Lift this up. Lift this up. Alright, just get the first. Thank you. And make sure everything is normal, and make sure your patient is in semi-palace position, 30 degrees. Do you have any pain? Are you feeling any pain right now?
No,
Okay, can you rate them from 0 to 10 if ever you're having any pain?
0.
0. Okay, good. So make sure before you do that, put a towel or chucks on your patient's chest before you start. Yeah, I'm gonna go remove this pen on you. Thank you. And just make sure that. And here's your basic. Here's your basic just in case, okay? So first make sure you check your patient and use tissue for later so you can blow your nose. Also I'm gonna go check the nose for any bleeding or anything. Okay, it looks good. So now I'm gonna remove it. Chin.
Hi, how are you today? Good, how are you? I'm good, thank you. My name is Shelby. I'm a student from Nevada.
Should we put the gloves on?
Can I get your first and last name and your date of birth, please? Alright, Miss Sheila, so today, I'm here to so your introduction and possibly food and vacation. For the injury,
So once your gloves are on, you can go ahead and detach the face. Okay, once I take your remove your tube, make sure you don't remove it now, okay?
Okay.
So make sure that just inhale for me and hold your breath, okay?
Okay.
Okay, inhale, hold your breath, please. Okay, I'm going out. Thank you. Just make sure that you heads up. And 180. I'm almost done, okay? Alright. Now you can breathe in. How are you feeling, Sharon?
Much better, thank you.
Alright, I'm sorry about that, but make sure you check your tube, make sure it's intact. Everything is good, no blood, nothing. Okay. Good job. And you can blow your nose. Good job. Are you feeling any pain right now?
No,
Very good. Are you having trouble breathing or anything?
no.
Alright. So once you're done with that, make sure you assess your patient's breath sounds and bowel sounds. And chin. So listen to your chest first. Breathe in. Very good. Breathe in. Good job. One more time. One more time. And assess the bowel sounds also. Normal active bowel sounds present. And then back. Breath sounds. It's clear to auscultation. Thank you. And make sure you reassess your patient's nose and mouth for any bleeding or any secretion. Okay, it looks good. Okay, here's your extra tissue just in case you need it. Okay? Now I'll be right back, and then make sure you document everything in your patient and all your assessment. Okay? Thank you so much. Thank you. Make sure you document all relevant information: the date, the time. Make sure you document the removal of the tube if it's intact, the amount and appearance if there's any bleeding or inflammation, and also the assessment of the patient. And make sure you put the name of the nurse and the date and the time. Thank you.